Doug Ford government plans to cut funding for local public health units and $1 billion over 10 years to Toronto Public Health. What could possibly go wrong? Public health is all about the headlines that you don't see. When it's working, it's practically invisible. Public health works upstream to prevent us from getting sick. Public health prevents cancer. It prevents chronic disease. It prevents infectious disease. It prevents deaths from the opioid crisis, and we've already lost so many people. Funding to public health also doesn't make sense. For every dollar that you spend on public health, you save $4. So for the child who never has to go to the emergency room with pneumonia, for the older person who never goes to the emergency room with food poisoning, those are dollars saved. Public health works silently in the background to save money and to save our lives. So why are we as emergency physicians who help people in crisis so outraged about the cuts to public health? Because nothing is worse than seeing the result of public health failures. To see people suffer the long-term ravages of diabetes, of smoking, to see people in pain after a car accident that could be prevented, to see babies suffering with measles. And for me, every day, to practice hallway medicine, knowing that public health is an integral part of the solution. As a frontline ER doctor, I am asking the government, and on behalf of the people of Ontario, to use your head, and to use your heart, and reverse these cuts.
So as we've already heard, as doctors, we know that public health protects us. But we're also citizens, we're people of Ontario. And we know that we rely on public health to protect us ourselves from illness and injuries. The fact that I can go about my daily business without having to think about getting an infection, or drinking contaminated water, or whether our kids have safe and healthy places to grow. That is public health programs and services working in the background to keep us healthy. But there's more work to be done. We know that 1 in 5 households in Toronto does not have enough food. We know that the opioid crisis is still taking lives. While cuts to public health hurt the most disadvantaged among us, we also know that all of us are going to feel the pain. Because our health is what's most important to us. We can't go to work or enjoy time with family or friends without it. If you own a small business in Ontario, you should be worried. If you're a parent with children in Ontario, you should be worried. If you live in Ontario, you should be worried. As doctors, we know that public health has our back, and we're standing up for that. It's easy to say that we can save money by cutting the budget. But are we really saving anything if we get sick? No. Are we really saving anything if the delivery of our health care is for profit? Or are we just paying for it later? So I ask, as people who live in Toronto, in Ontario, can we really afford cuts to our health?
Thank you so much, and I want you all to remember the names of these 3 physicians. Dr. Raghu Venugopal, Dr. Edward G., Dr. Jennifer Hume. They are 3 of the 100 physicians, emergency room physicians, who spoke out with Joe Cressy, chair of our Board of Health, saying exactly what they said today. Their impact was, I think, extraordinary. They're a new generation of young physicians who are standing with the people of this province, and we want to thank them so much, because the weight they bring will only help our cause. So thank you so much for coming out today.